in our federal government, somebody needs to get with the CDC, with our medical industry, and take the prescribing guidelines, go back to 1998 when they changed them and made pain the fifth vital sign, and start prescribing less.
If I were speaking to Donald Trump, some of the things that I would encourage him to enact that would help make an impact in the opioid epidemic would include, one, keeping Medicaid expansion. Many of our patients are seeking treatment for the first time because they were eligible for Medicaid expansion in Ohio, and they therefore had access to treatment that they previously would not have. If Medicaid gets cut, it will be very difficult for these patients to seek treatment.
I think they've done well with the Narcan program, the Project Dawn, and starting the Vivitrol programs. And I think the increased health care to many people in this area has been helpful. This is an area pretty poverty-stricken.
I think the federal government has been a little bit slow to address this, but I think they are addressing it and they're coming around.
If I was speaking to Donald Trump, and what I would say to him, if I could tell him what I think would impact the opioid crisis, would be help. I mean, we need to stop jailing and we need to start finding more help resources.
I don't think we're at the point where things are getting better. I think we're at the point where it's finally reached a national level of consciousness, but I don't think we're at the point yet where we're seeing the decline of the heroin epidemic.
To have access to those resources through whether it be community or government-based programs like Job and Family Services or Stella Maris Detox and inpatient treatment centers. Those are the type of community programs that we need more of, I think, in order to conquer and thrive in light of the problem that we're facing.
I believe the federal government, when they are discussing the local heroin epidemic, especially in rural communities, they should look at providing tools to our communities that will help us combat this problem. Rural communities versus urban communities are very different. I truly believe that in rural communities, just funding doesn't necessarily make a difference.